Thanks so much for being with us. Far more people have died from malaria across Africa than from COVID-19. You know, they're mostly children. And from your report, we understand it's actually getting worse.
Absolutely. Unfortunately, the case is that there were at least 20 countries this year that were supposed to receive new bed nets. And a bed net or a mosquito net is protecting people against malaria as a disease. And these nets are manufactured in Southeast Asia. And due to COVID, there was much less production of nets and therefore far fewer nets that reached Africa. And as a result of that, people don't get protected. And the risk is there that they will newly contract malaria. And as a result, we'll have more cases and even more deaths.
And they are really such simple measures in so many cases and not expensive. They're not asking for massive vaccine research. These are basic things like mosquito nets that aren't getting to people. And it's ironic as well, you know, to hear people talk about the dangers of, you know, the COVID vaccine nationalism you may have heard of, where poor countries will be left without the same access to life-saving vaccines when we have an epidemic like malaria that's killing even more people in poor countries, and it's never even been considered a real health emergency.
I mean, the sad thing about malaria, if you compare it to COVID, with COVID, we don't yet have a commercially available vaccine yet. When we're talking about malaria, we have the tools in our hands to not only prevent it, but also to treat people and cure people. So the tools to deal with malaria are available. It is a choice that we don't do it. It is a choice that we leave Africa where it is and not make sure that it has enough funding to respond to the malaria menace that we have. So it is a truly sad thing for mankind that we're leaving behind an entire continent, whereas we have the tools to fight this disease at hand. And that is distressing in a world that is pumping billions upon billions in developing a COVID vaccine, and we're just leaving the people suffering from malaria behind.
Right. What do you want to see changed right now?
Well, I think a massive stride forward can be made by at least doubling the amount of money available for tackling the malaria problem. We are looking at something like in the order of 6 billion to 8 billion that would be needed on an annual basis to better control malaria as a disease around the world and help countries to truly move forward to the complete elimination of the disease compared to the way it is at the moment. So funding is a key way forward, but also innovation, innovating new tools, innovating new strategies, and bringing strategies together to truly attempt to eliminate malaria. And at the moment, there is not a single place in Africa where we are really bringing all the tools together in an attempt to completely wipe out the disease once and for all.
Bart Knols, great to talk to you. Thanks so much for joining us. We really appreciate it.